Welcome to the Dr. Mama Says podcast, where you will hear a variety of timeless tips on parenting and healthcare. Thank you so much for joining today, and now it's time to get on with the show.
Hey there, everyone. I'm Dr. Burton, the host and creator of the Dr. Mama Says podcast. Thanks so much for joining me again today. All right, so this episode intends to share an overview of a really wide range of headache causes. I'm going to briefly talk about them, maybe share some examples, but understand that each and every one of these categories could have an entire post dedicated directly to it. A headache is not just a headache. Most of us get them from time to time, but every time you get one, there is actually a reason. Your body's trying to tell you something, so I suggest you listen. Although most headaches are never evaluated or treated, it's important for you to understand that there are many horrible causes of headaches. Some of them are life-threatening, so be sure to speak with your physician if you have a concern. So how common are headaches? The short answer, vary. There's lots and lots of information online, as many of you know, but I'm going to share some general information right now. About 2/3 of people will have a headache at some point in their life. Wow, I pretty much thought it was 100%. I don't know anybody who's ever said, I've never had a headache in my life. But I guess there are some of those people. 15% of headaches are caused by migraines, and over 50% are due to tension headaches. 4 to 5% of emergency room visits are due to headaches. And headaches are one of the most common reasons that people use over-the-counter pain medicines like Tylenol and Motrin. And although these medicines are usually pretty safe, both of them can lead to some complicated medical problems. Like Tylenol can cause liver damage. Aspirin, although it's not taken a lot, some people do use aspirin, can increase your risk of bleeding because it slows down the ability of the blood to clot. And Motrin not only can cause irritation of the stomach, giving you gastritis or ulcers, but it can also lead to worsening or actually causing kidney damage. So it's best to determine the cause of recurrent headaches and find a specific treatment plan. Medical history is the most important way to determine what the cause of that headache is. And I'm always beating that drum to talk about how important it is for you to know your history. When discussing your symptoms with your physician, it's a good idea to write down the symptoms before going in to see the doctor. As an ENT doctor, I see lots of headache patients, and so these are some of the questions you can count on me asking you, although family physicians, pediatricians, and neurologists might ask a different series. But for me, I ask how long they've been happening, what time of day do they occur, how long do they last, what makes them better, what makes them worse. What are some of the other things that happen symptom-wise that happen before, during, or after the headache? Have you had any recent illnesses? And my favorite, take one finger and point to the area that tends to have the worst pain. So in kids, they tend to draw big circles, kind of covering their whole head. And I say, no, narrow that down. Touch the spot that tends to hurt the most. That location can give us a clue as to what the cause of the headache is. So there are basically two categories of headaches, primary and secondary. A primary headache means that the headache itself is the problem. There's not another cause, meaning there's no nasal congestion, no infection, no other medical problems, just a headache. Wouldn't it be nice if all primary headaches were easy to spot? There can be associated symptoms with a primary headache, so that's why it can be confusing. Yeah, I can speak on this because I had migraines. I had them terribly in high school and college. And don't even get me started talking about how severe they were when I was pregnant with my kids. But they did get better over time. So yay, finding another thing that's great about getting old. But honestly, the key to differentiating a secondary headache from a primary headache is based on that history. So some of the features of a headache that often kind of points to it being a primary are symptoms such as the pattern is stable. It's been that way for months or years. There's a family history of similar headaches. There's a normal physical exam. And the headaches can seem to be triggered consistently by hormone cycles, specific foods, sensory inputs, or weather changes. As we talk about primary headaches, this category is generally due to an overreactivity of some of the pain-sensitive structures in your head. There's some change in the chemical activity in the brain, the nerves, vessels, muscles around the head. All of these things can contribute and play their role in a primary headache. So most of these types of headaches fall into one of these three categories. The first one is the tension headache. It is the most common cause of a primary headache. There's not been a lot of research done about this common headache, and part of that is because before 1988, there were lots of different names for this group of headaches, such as muscle contraction headache, the tension headache, the psychogenic headache, meaning it's all in your head, or stress headache. I've heard of a stress headache, but eventually there was a better definition of what is included in this category, and generally this headache is not as severe as some of the others. It's often described as a band-like aching, squeezing, not usually a throbbing pain. Often it affects both sides of the head and is not usually associated with light or sound sensitivities or nausea and vomiting. Muscle tenderness of the head, neck, and shoulders is a very, very common part of this. Migraines make up the second most common type of the primary headaches, and it's a disorder of recurrent headache attacks. They can be described as severe, throbbing, pulsatile, kind of like you can feel it with your heartbeat. Usually one side of the head is worse than the other. It's commonly associated with nausea, vomiting, and sensitivity to lighter sounds. Sometimes people with migraines know that the attack is coming because 1 or 2 days before the headache, they get some symptoms like constipation or diarrhea. There's some mood changes. Their appetite changes. They can have food cravings or not have any hunger at all. They can have concentration difficulties, coldness of their hands and their feet. They frequently are thirsty, or they seem to be tired with constant yawning. Some warning signs called an aura, A-U-R-A, often occur before a headache. These usually are visual changes or sensory changes such as tingling or changes to the touch of the side of the face. 70 to 80% of migraine sufferers do not have an aura. I had an aura. Usually, my vision would seem to go black or gray. My field of vision would narrow. Occasionally, I'd feel some tingling on the side of my face or my mouth. I remember the most severe attack of migraines ever. It happened during my internship year. In case you don't remember, during my episode about the imposter syndrome, my internship year was extremely stressful. And yeah, this was an awful time for my headaches as well. Well, my aura came as usual. My headache blossomed, but I kept working. Normally, I would go rest, sleep, go into the dark. In high school, when I would have a migraine, I would come home from school, go directly into the bathroom, turn the lights off, and take a nap with my forehead pressed against the cold bathtub. If you have not done that, I'm going to let you know that pressing your head on a cold bathtub feels much, much better than a bag of ice on your head. Just a side note in case you want to try it one day. During my internship, my days were long, and I could not find the time to rest. And I had to allow the migraine to try to pass. I kept pushing, trying to prove my worth, trying to prove that I was not an imposter. I remember feeling like it was really, really getting hard to talk. And I just thought I was getting tired. And then I started noticing the shocked look of my teammates. My facial symptoms had progressed to a full-blown weakness, and it looked like I was having a stroke. I explained, nothing to see here, just having a migraine, just couldn't find the time to rest. Thank goodness the physicians on my team knew enough was enough. They took my beeper. That's right, you heard it. They took my beeper, and they sent me to the call room and said, you need to lay down. Notice they didn't send me home. They told me to go lay down, and I took that as a win. I went into that room. I went to sleep. A few hours in the dark, I woke up good as new, grabbed my beeper, and went on back to work. Never ever had another episode that bad because as they came, I knew wherever I was, whatever I was doing, I needed to shut it down and not let that progress. There are some known triggers for migraines such as menstrual cycles. Women get them 3 times more than men. Visual stimulation, bright lights, fasting, meaning you're not getting enough food, wine, physical exertion, sleep disturbances, and sometimes even drinking highly caffeinated beverages. I'm always surprised when I read about caffeine beverages as a cause because one of my treatments back in the day was a pill that had a lot of caffeine in it. The most common trigger of the migraine is stress. And when someone gets stressed, their brain releases a chemical that gives you something that's called your fight or flight reflex, meaning something's going on and your body's either going to dig in, take a stand and fight for it, or you're going to turn and you are going to run. But either way, that anxiety, worry, fear, it can create enough tension and it can make that migraine much worse. This is why laying down, resting, reducing stimuli, one of the best treatments of a migraine. The last category of the primary headaches is called the cluster headaches. These are also known as histamine headaches, and they're pretty rare. Usually the pain is severe on one side of the head, near the eye, temple, or forehead. The pain may begin quickly without warning, and it may become very, very tense, but it usually doesn't last more than an hour or two. And often, there's one of these other symptoms that are associated, such as a red watering eye, a drooping or swollen eyelid, a pupil that's smaller than the other, sweaty, clammy face, and a blocked or runny nose, one side. These are all symptoms associated with histamine, and that's why this headache is due to that. All right, let's move on to those secondary causes of headache. Number 1, dehydration. You can just ask my girls, but one of my favorite questions to ask them, no matter what they said was wrong with them, was, how much water did you drink? Because keeping your body hydrated is important for many, many reasons. And if you get dehydrated, there's a whole host of symptoms that can occur. Headache is one of them. But let's be honest, there are many days we could all drink a little bit more water. So if you start feeling bad, take a minute and reflect on your hydration status. All right, hunger is also a cause of a headache. Many dieters can tell you that sometimes when your body thinks it's hungry, it's actually thirsty. So this just throws us back to the dehydration cause, but hunger and starvation all by itself can lead to some headaches. I got a little personal story about this as well. So you know I'm super type A. When I focus on a project, the whole world seems to disappear. I'm not thirsty, I'm not hungry, I'm not sleepy. I have a great ability to tune out the world. It's great in terms of getting work done, not so great for your health. During medical school, I would study. I would miss dinner. Then I would wake up, run to class, skip lunch. Eye on the prize, right? Yeah, well, it's eye on that prize, but my body can only take so much. So I gotta tell you, there were several times when I would pass out. That's right, flat out fall on the ground. My friends at first were really scared, but eventually they were like, Debbie's hungry, and they would reach into their purse and pull out some candy. So you know you've got some good friends when they have some little candies in there in case they see you going down. Another time this impacted me was when I was dating my boyfriend, now husband. He was a workout king. And here I am, I'm studying, I'm doing all these different things. But I'd wake up in the morning, we'd go to the gym, we're working out, he's lifting weights, and I'm doing something, maybe a step class, aerobic class, whatever it is. But you know I didn't have breakfast. So we had finished working out, and he said, let's go to breakfast. And I was like, yeah, let's hurry up. But I could tell my headache started coming, my vision started changing. I only had a few seconds to let him know, hurry up and get me up the steps because I don't want to fall down the steps. He valiantly tried to struggle to help me walk, but you know, when you're passed out, you're passed out. Your body's got to do what it's got to do. Good thing I learned for myself. I got to drink water. I got to eat food. All right, back to the headache causes. Stress. I mean, come on. Stress is a classic trigger of headaches, so don't really need to dig into that a little bit more. Eye problems can also lead to headaches. Sometimes eye doctors find glaucoma, which is an increased pressure in the eyeballs. These can also lead to headaches. Many of my patients have already seen an eye doctor for headaches. They've had new glasses prescribed, but when the headache continues, they realize something else is the problem, like maybe that dang stuffy nose. Dental and jaw problems are another category, and the TMJ is a term we use for a fancy area named the temporomandibular joint. It's the area you feel when you place your hands directly in front of your ears and then open and close your mouth. This joint can have a variety of problems that are associated with it, and all of them can lead to some head pain. Other dental and jaw problems may lead to poor alignment, other issues that also can give headache and head pain. How about headaches due to external compression? If you wear something continuously on your head, it can put pressure on your forehead and scalp. These most often happen to people that wear certain headgear such as helmets, goggles for their work or sports activities. Other people who get these type of headaches can be construction workers, people in the military, police officers. Obviously, the solution is remove the external compression, the headache goes away. This time, instead of me sharing a personal headache story, I'm going to share one from my daughter. In kindergarten, she had been invited back to her preschool to be a guest for the annual Halloween festival. She got all decked out in her little cat costume. After we'd been there for an hour, she was in tears. She came in talking about she had the worst headache of her life. And if you're a physician, those words mean something. Worst headache of your life. We jump right to the ugly headache problems that I'm going to talk about. So after pumping her full of water, giving her some food, having her lie down, she was still crying in pain. By this time, we decided we needed to leave because we were going to have to take her to get checked out. Once we decided we were going to be leaving the party, she took off her cute little cat ears. Yep, all this time she'd been wearing a headband with cat ears that had been squeezing her head. Within a minute or two of taking off that headband, boom, that headache was better, and she was not interested in leaving that party anymore. She continued on as the honored visiting guest without her little cat ears. All right, so who's not had brain freeze from ice cream? The ice cream headaches, they're brief, stabbing headaches that can happen when you drink or eat something that's really cold. This headache can also be caused by exposing your head to sudden or extreme cold or having something cold move across the roof of your mouth or the back of your throat. such as eating ice cream quickly or gulping a really cold drink. Officially, this is called the cold stimulus headache, but nah, that is not nearly as good of a name as brain freeze. The good news, most ice cream headaches are gone as quickly as they develop. Scientists aren't exactly sure why it happens, but one of the theories is that the extreme cold temporarily causes the blood vessels to clamp down really hard and then suddenly release, and that change in blood flow leads to this burst of pain. Nasal congestion as a cause of a headache, this category is my bread and butter. I see this daily. It is not uncommon for me to see kids with chronic headaches who've already seen a neurologist. They've had CT scans and MRI scans looking for other reasons for headaches. I've already posted some blogs and podcasts about allergies, mouth breathing, nasal congestion. No particular reason for me to elaborate here other than to say that this category includes the common cold, other viral illnesses, allergies, and turbinate enlargement. Not sure what a turbinate is? Check out my post about the fabulous function of the nose, where it talks about how the nose works as well as the anatomy. Sinus problems I put in a different category than nasal congestion because it's a step up and it takes things to the next level. There can be acute or new sinus infections, chronic sinus infections. There can be nasal polyps, tumors, cysts. Lots of things can go on in the sinuses. I've done a whole series about sinus cavities, their anatomy, how to diagnose problems and different treatments. But let's just say sinuses can give problems due to direct pressure or triggering of nerves. The next category is the adenoid. And you know what? I just cannot believe I have not done a post about the adenoid. I evaluate them every day, so I'm going to have to get on that. But the adenoid's a lymph node located in the back of the nose. I call it a nose tonsil because people have never heard of it before. No one ever asked me what a tonsil is, but I'm always asked what an adenoid is. Same thing, different location. If it gets inflamed or enlarged, that adenoid can block the nose and can be a cause of a headache. A deviated septum also can lead to a headache. The septum is a piece of cartilage and bone that divides the nasal cavity into two equal passageways, or they're supposed to be equal. If the nose is crooked due to birth trauma, some other trauma, just born that way, the nose is not divided equally, and the narrow side may allow the septum to either touch the other side of the nose or block the sinus, but either way, a deviated septum can cause a headache. A little fancy trick I sometimes do for kids who are having a headache while they're in my office, I take a piece of cotton, I dip it in some Afrin, and then I put it up high into the nose to shrink down some of the tissues inside the nose. And within minutes, the kids are telling me, oh, my headache, the pressure is so much better. And yes, I look like a rock star. And anything you can do to look like a rock star, it's a good thing. In adults, generally, this is done using lidocaine or other superficial pain relievers. But when I've done that in kids and that trickles down the back, then it doesn't taste good. They get all dramatic because the back of the throat feels funny. It's numb. They feel like they can't breathe. And nobody needs extra drama. So I just use a little Afrin, shrink it down, and then say, that crooked area, that's the cause of your headache. Throat problems can also lead to headaches. In my patients, strep throat can often present as headaches. It is one of the most common symptoms that I see. So it's really important in kids with headaches to check their throat. Other causes of irritation in the back of the throat can be the allergies with postnasal drip, viral pharyngitis, and even gastric reflux because kids are burping up and they can have chronic sore throats leading to a headache. The brain is the big category that we worry about when it comes to the head. When checking headaches, this is the category you don't want to miss. These are the ones that have those potentially life-threatening ones. And some of these symptoms can overlap with the symptoms of the other headaches I've already discussed. So some of the most common brain problems associated with headaches include bleeding into the fluid that surrounds the brain or bleeding into the brain itself. There can be infection in fluid around the brain, or infection into the brain itself. When it's infection into the brain itself, it's called encephalitis. When it's the fluid around the brain, it's called meningitis. Encephalitis can be caused by many different viruses, but commonly it's due to some of the preventable ones like the flu or the measles, things that could have been prevented with those vaccines. So, side note, vaccines work. Get your vaccine today. All right. The last two causes of headache are going to end on a lighter note than these heavy brain life-threatening causes. High blood pressure. High blood pressure is often thought to be associated with headaches. Most people with hypertension never get a headache. If you do have a headache with high blood pressure, it's often a very severe elevation of your blood pressure. High blood pressure is called the silent killer because it often doesn't share any other symptoms. And then the last one I'm going to talk about is substance abuse or withdrawal. This category includes the well-known hangover from excessive alcohol the night before or caffeine withdrawal when a coffee addict decides they're going to suddenly quit cold turkey. That's not a good plan. In ENT, I see this problem a lot in people who've become addicted to that Afrin. Well, some people self-medicate with Afrin, but when you've used it regularly, it changes how the nose functions, and when you stop, there's a rebound swelling that can lead to some severe headaches. Whew, what a whirlwind summary of the many, many causes of headache, but not nearly all have been covered. But perhaps this information will help you to consider your symptoms and be better able to discuss them with your physician. So for now, I gotta go. Thanks so much for joining me, and I look forward to you coming back to check out another episode soon.
I truly want to thank you for spending your time listening to Dr. Mama Says, because without you, there would be no podcast. If you enjoyed what you heard, please go to iTunes and consider leaving a 5-star rating. This will help gain the support needed to continue bringing new and exciting content. To review information presented in this episode, a summary of the show can be found on www.drmamasays.com. And don't forget to subscribe. Hope you come back and listen again soon.